Welcome back to the channel. Thank you for your support. Every like, comment, and share helps us spread clear and reliable awareness about psychology and mental health. If you're like many people, you might think OCD looks like this. I just like everything arranged perfectly. Or maybe you've heard someone say, I'm so OCD, I have to check my alarm 3 times before I can sleep. You might even hear phrases like, be a little more OCD about this. But none of these examples truly describe OCD. What OCD actually looks like is very different. So, what's really happening? How does the mind of someone with OCD work, and what kind of help is available? Before we get into that, let's take a step back and understand the basics. What is OCD? Obsessive-Compulsive Disorder, or OCD, affects a little over 1% of people in a given year. That makes it far less common than most anxiety disorders. Statistically speaking, most people do not have OCD, but you might be here because someone you care about does. While OCD is not widespread, it is extremely serious. Nearly half of those living with OCD experience severe disruption in their daily lives. Simple tasks like using the bathroom, replying to messages, going out, being at work or school, or even spending time with loved ones can feel overwhelming and intensely anxiety-provoking. When people casually say, I'm so OCD, they're usually referring to liking cleanliness or double-checking things. But using OCD in this way minimizes the real struggle people with this condition face every day. OCD is not a habit, a preference, or a personality trait. It is a biologically based mental health condition. Although researchers are still studying its exact causes, we know one thing clearly: it is not your fault. OCD often begins early in life and may worsen during teenage years or early adulthood. How OCD affects the brain. The neuroscience behind OCD can be complex, but here's a simplified explanation. In people with OCD, brain systems involved in error detection, reward processing, memory, and movement don't communicate as efficiently as they should. The brain is wired a bit differently. For most people, when you turn off a light switch, your brain registers the task as complete and moves on. For someone with OCD, that same action may leave lingering uncertainty and anxiety. The mind then tries to explain that anxiety by creating a story. Maybe it wasn't turned off properly. What if there's dust inside? What if this causes a fire? This storytelling is something the brain normally does to make sense of the world. In OCD, however, it's trying to explain anxiety that doesn't need to be there in the first place. Obsessions and compulsions. This is why people with OCD experience intrusive thoughts, images, or urges that feel illogical and hard to dismiss. These are the obsessions. To reduce the anxiety caused by obsessions, people often perform compulsions, repeated behaviors or mental rituals meant to feel right or complete. These actions may temporarily lower anxiety, but the relief doesn't last. Eventually, the anxiety returns, restarting the cycle. The role of doubt. One of the defining features of OCD is persistent doubt. People with OCD often feel trapped by questions like, did I do that correctly? What if I made a mistake? What if something terrible happens? This doubt can take over large portions of the day, making even basic tasks extremely difficult. One patient once described OCD as the thief of time, and that description fits. OCD can slowly consume attention, energy, and daily life. Do I have OCD? At this point, you might be wondering whether you have OCD. It's important to understand that intrusive thoughts are common. People without OCD experience them too. Having a disturbing thought does not mean you have OCD. Thoughts are not actions, and they are not dangerous. The difference is how much time and distress they cause. People with OCD may spend over an hour a day stuck in these thoughts, repeatedly analyzing them and responding with compulsions. This is very different from general worries about work, relationships, finances, or health, which may be linked to generalized anxiety rather than OCD. Treatment and hope. The good news is that OCD is treatable. Several medications have been shown to help, often targeting serotonin pathways in the brain. There are also highly effective therapy options, especially cognitive behavioral therapy, including exposure and response prevention. This approach helps people face uncertainty without engaging in compulsions, allowing the brain to gradually relearn that anxiety does not require action. Other therapeutic approaches, such as acceptance-based therapies and inference-focused CBT, can also be helpful depending on the individual. Treatment plans vary, and support from trained professionals is essential. If you or someone you know struggles with symptoms that feel overwhelming or persistent, professional help can make a real difference. Here at MedEd our goal is to provide clear, medically grounded education to help you better understand mental health conditions, without stigma or misinformation. You are not alone and support is available. Thank you for watching MedEd. If you found this video helpful, consider liking, sharing, and subscribing for more evidence-based medical education.